If you're suffering with knee pain and you're not sure who you should see or what you should do, then I strongly encourage you to follow these exercises and recommendations, because these are the exact same pieces of information that I give my clients here at Knee Pain Clinic, and these are what I use to get the results that I get. The first and easiest thing I want you to try is to upgrade your footwear. What I mean by this is, most of my clients when they come in, particularly here in Australia, they tend to wear a lot of flip-flops or thongs as we call them here, or sandals, or just not well supported shoes. So what you want to look for is just a basic runner that has good cushioning throughout the sole of the shoe, and also has good arch support through the inside. Now, you don't want something that's too rigid in terms of, you still want the foot to be able to move in the shoe, but you don't want the shoe to be too restrictive so your foot has to work too hard to overcompensate from the shoe. You also want to make sure that the shoe can twist like this, and the shoe can always bend up like this. This is probably a little bit rigid for what I would recommend. This is my running shoe, so it needs a bit more stability, but as your everyday kind of trainer or runner, you want something that's just going to support the foot, so that that the knee feels more confident when you're walking, particularly on uneven surfaces. If you have well supported shoes, then that'll help that, and it will also help the foot to move more freely and increase the stability through the ankle, which will then also help the knee. The next thing I want you to do is to improve your diet and nutrition. This is probably one of the more harder things to try, because it takes a lot more energy and effort and commitment, but it is by far the best way to just improve your overall health, but also to help you reduce weight. Weight is one of the biggest contributors when it comes to putting excessive strain and load through the joints, and when it comes to the knee joint, it's one of the first things I always try and tell my clients to improve. Now, you really don't have to get too complicated when it comes to diet, nutrition, and the foods that you eat. You've just got to try and eat smaller portions and try and cook more home meals, because that means you're going to not eat as much sugar or eat as many carbs or eat as many bad fats, and you're going to be able to control what you're putting in your food. Most people make the mistake of trying to exercise first when they're trying to lose weight, but actually it's your diet and nutrition that is where you should be starting. As well as improving your diet and nutrition, I also want you to increase your fluid intake. The majority of people drink less than 1.5 to 2 litres a day, and that's just not enough to keep your body hydrated. Your body is made up of 80% water, and when you become dehydrated, not only does your brain function decrease, overall your body is in a dehydrated state, and that actually affects the tone and condition of the muscles, which then has a knock-on effect to the tendons and the joints. Basically, your body's working harder. You really should be aiming to drink at least 2.5 litres of water a day, closer to 3 if you can, and you should notice an overall improvement in your health and well-being. Now, I don't want you to just drink 2.5 litres in one sitting. It's important that you try and space it out during the day, and it will take about 4 to 6 weeks for your body to accommodate to the increased fluid intake, and then you'll find you don't have to go to the toilet as much in the long term. The last thing that I want you to try when it comes to lifestyle recommendations is to exercise. Now, you have to be really careful with this one, because most people think they have to start with exercising, but it's actually the thing you want to leave till last. And the reason being is because most people get really sore and achy during exercise as well as after, and then that actually discourages them to doing anything about it. So the important thing is that when you're exercising, it shouldn't be painful, or should at the most be like a 2 out of 10, and it should feel better after exercising. If it's really painful during and then really painful afterwards, then you're most likely doing too much. So the 3 best exercises for you to start with, it would be swimming, cycling, and walking. So when it comes to walking, as I said previously, make sure you've got good shoes and try not to walk on uneven surfaces or downhill or any steep decline. That'll put too much pressure on the knee. When it comes to cycling, make sure your bike seat is up high enough so that your knees don't bend too much. I will do another video of this at another time, but just make sure that your seat is up high enough so that your knees don't have to bend as much, because it'll put too much pressure on the knees if your seat's too low. And then when it comes to swimming, try and wear flippers, because that'll mean you don't have to put as much movement through the knee, and it will also help to strengthen up the tendons and the muscles in the leg more effectively. Once you've tried those 3 exercises and you've tried my other recommendations, now it's time to try some really specific, focused rehab exercises, and these are the ones that will help increase the strength of your legs.